Okay, thanks everyone for being here. We're in the Zoom room. Welcome to the Politics of Information webinar series, organized by the Center for Access to Information and Justice at UWinnipeg, featuring speakers who research surveillance, data, and power in the digital age. The Center for Access to Information and Justice is focused on public interest research and use of freedom of information in social science. I want to start out by acknowledging that the University of Winnipeg is located on ancestral lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. And I also acknowledge that our waters in Winnipeg are sourced from Shoal Lake 40 First Nation. Thanks to the UWinnipeg event team and media team for working on the CAGE webinar series for 5 years now. Here's the format for today. We have live translation. Thank you very much for being here. We have a total of 60 minutes or so with our featured speaker, Megan Linton. We're going to have questions that the audience can pose after Megan's presentation, and you can feel free to pop your questions into the chat or the Q&A tab in the bottom. So now let me present to you today's featured speaker, Megan Linton, who is a PhD student, writer, and researcher. Her research uses critical disability and carceral studies to challenge disability institutionalization and their profit motives. Megan's writing has been published in Briarpatch, the Disability Visibility Project, Canadian Dimension, CBC Opinions, the Hamilton Spectator, and Ottawa Citizen. Megan has also produced and wrote the Invisible Institutions podcast. Megan works as a teaching assistant and as an instructor in the departments of sociology and criminology and criminal justice at Carleton University, and as a research assistant on many projects related to ability and disability, political economy, and public policy. Thanks very much, Megan, for being here today. The floor is yours for your presentation.
Thanks so much for having me. I'm just going to share my screen. And there we go. So thank you for that incredibly kind introduction. And yeah, I am here today as a disabled and MAD community member, a survivor of institutionalization, and an organizer with the Disability Justice Network of Ontario, which is a provincial organization committed to abolitionist organizing against prisons and all forms of institutionalization that confine disabled, MAD, and older people. And so we have on the screen the title of this presentation, Access Through Information, FOI Best Practices in a Disability Justice Context. And surrounding this beautiful title are 5 text fragments pulled straight from the Ontario government's Open Data Catalog. The catalog says, data under review. This data is not available right now. We are reviewing the data to determine if it can be made open to the public. There's another one that says this data is restricted and will not be made available. The data was reviewed and cannot be released to the public because of reasons outlined by the Digital and Data Directive. And today I'm presenting actually, and if you hear some like weird animal sounds in the background, it's because I'm at the archives at York University, which is located on the treaty lands governed by the Mississaugas of the Credit First Nation and subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. And just to touch on the fact that universities, through this process of colonization, have been part and parcel. And being at the archives here in Ontario really just highlights how fundamental these institutions are to maintaining our current regime of colonization. And so in today's presentation, we're briefly going to touch on ideas of disability institutionalization and the ongoing struggle in accessing information, both from the archive, um, on, ongoing struggle in accessing information both from archives and from governments today. And then we're going to touch on more of the contemporary issues in accessing information amidst privatization. And then we're going to go through 3 challenges in terms of information access. The first will be accessing personal, and then institutional, and then systemic information. And on the screen here, we actually have a great example of a historic FOI story. So on the screen is an image of a crib cot. And crib cots were revealed to be used in Ontario's institutions through the 1980s. And it was actually only following the death of a resident in a nursing home just outside of Ottawa that it was revealed how pervasive the practice of crib cots and crib cotting patients was. And so crib cots have bars along the entire side and then also along the top, which mean that patients are stuck in to these fragments. On the bottom, just below the crib cot, is a fragment from an Ontario hospital school. This one's from Aurelia, and you will see different fragments from the archives produced over at Wilfrid Laurier University through this presentation. Okay, so through this workshop today, we're going to talk about some really heavy ideas and concepts. But fortunately, we have fighters to bring us through these really challenging issues and situations that have come up in which freedom of information has been really helpful. And so my research and community work explores the cycles of institutionalization in so-called Canada and the confinement of people labeled with intellectual, developmental, and/or mental disabilities. This is an ongoing phenomenon which stretches back more than a century and a half in this country in which we have colonized and forced up these institutions. Disability in these contexts is used as a tool to justify state custody through the child welfare system alongside the guardianship system, both of which can place disabled people in the custody of the state, who then is responsible for determining where someone is allowed to live, what medication they take, and who provides their care. So on the screen here, we have 4 individuals who have made great contributions to the fight for justice and the fight for truth from disability institutions. In the middle, we have a picture of David Weremy. David Weremy has led the fight for the Manitoba Developmental Center closure and also the release of their records. In the bottom, we have an image of a beautiful black cat with wings created by Carrie Ann Ford, a survivor of the Huronia Regional Center here in Ontario in Aurelia. And then we have 2 more people, Mary Slark and Pat Seth, who are 2 women at the bottom of the screen, both wearing blue, smiling after the closure of the institutions in Ontario. And they were the leaders of the class action legal cases that happened in Ontario. And so I think it's important to really recognize the work that has been done by disabled people in both identifying practices of obfuscation, practices of hiding information, and simultaneously practices of over surveillance, which then are challenged by resistance. And the resistance which has happened has been this fight for the truth. And this has been fundamental to my own work, in that I always am picking up the threads that survivors have left for us. And that has been a really important part of this practice that I use in my research, which is called leaving evidence. And so leaving evidence is a really important disability justice principle. And I want to bring it up in context here. And so on the screen, we have a really graphic image. It is a picture of a brick wall with scratch marks across it. This was taken by Sid Jackson for Recounting Huronia, and this image is from the pipe room in the regional center. And the pipe room was a horrifying room used for the worst forms of punishment at the regional center. But when survivors had spoken about it historically, they had been told that they were being hysterical, that they were making things up, that they were, just embellishing their experiences. But what we actually see here is this practice of leaving evidence and this picking up of this evidence, this seeing, this acknowledging, this carrying forward the evidence to all of us. And so this is what Mia Mingus says. We must leave evidence, evidence that we were here, evidence that we existed, that we survived and loved and ached, evidence of the wholeness we never felt and the immense sense of fullness we gave to each other, evidence for each other that there are other ways to live, past survival, past isolation. And so while this image is most certainly one just of survival, it is just that. It is a piece of survival that we can see and we can acknowledge and we can cherish as we go forward. And I think, in this time of ongoing criminalization and heightened institutionalization, it's really important to see the ways in which people have survived and have continued forward. And so within access to information, I think that disability justice provides a really important tool in recognizing the fundamental importance of seeing each other, for the complexity of the person, and going beyond just the institutional record. And so, with the survivors advocating for the closure of institutions and for the eventual class actions that came forward, we are seeing issues with regards to historic records. And today I'm mainly going to focus on contemporary records, but because of the context of the Manitoba Developmental Center closing so recently, I think it's really important to highlight some of these issues of access in terms of more historic records. And what do I mean by historic? So historic records refer to anything that constitutes living in institutions prior to their closure. And so there's an important challenge with class action lawsuits in this regard, because once a class action lawsuit goes forward, the defense, or the Crown, which is the government, will take all of those records and put them into their class filings. And so today I'm sifting through thousands and thousands and thousands of records, all that are in class action files, all that had to either be signed a research agreement or do a 1,000-page FOI. Because they went through a law settlement, they now are no longer able to be brought forward. And so I have three kind of notes on the screen, which is three types of access in which you can engage with historic records. So the first is access but, and this refers to access to records with highly specified limitations. This usually has issues in terms of confidentiality and usually limit certain forms of publicity or sharing broader. And so in recent years, this has been a really dominant practice in terms of class action settlements where survivors are allowed to tell their story, but for the record, but then are no longer able to share it anymore because they have shared their story with the record and now they're forced to sign a non-disclosure agreement if they're to access the legal settlement funds. So that's the access but. And then the second one is an access but not yet. So this is a very common practice within institutions where you can access medical records, but not until 100 years after the individual and those related to them have died. And so this is obviously a confidentiality practice, but what we know is that, especially following much of the work of journalists and investigators following the residential school cases, is that there's people who were killed in institutions who we don't know, who we know who did it or that there was an individual responsible, but we're not able to go into those records because there's this settlement or these stipulations around access to patient records. So it's access, but not yet. So you've got to wait. And what does that waiting mean? And who does that waiting impact? And what does that waiting look like? So all big questions. And then there's this third form of access, and I call this access with. And this refers to um, engaging records and archives and histories with survivors. And so this often looks like turning to community archives, finding new approaches to old questions, and bringing forward new forms of histories or making histories into archives in ways that are distinct within disability communities. And on the screen, there's also three pictures of corridors, and I wanted to share these. These are all institutional corridors. So on the far left, we have the Rito Regional Center, and that's a corridor within the hallway. In the middle is the Huronia Regional Center. This is a picture of the tunnels taken by a survivor on one of their last visits to the institution. So all of these corridors were like miles and miles long and connected all of the institutions. And then the third is also of the Rito Regional Center many years after its closure. And so these are kind of like the possibilities and challenges of accessing historic records. But I want to get into the more contemporary things. And so, in an excellent example of the access but not yet, this is a picture of Jeffrey Rium, who's a mad scholar and historian, and he has done amazing work with 100-year-old records from the Ontario archives here about this exact wall. So this was a wall at the uh, Toronto Lunatic Asylum, or what is now CAMH, the Center for Addiction and Mental Health. And this wall was built by patient labor, and he was able to get all of that information from the archives and tell that story for the first time to really recognize both the history of the space that we are in and also the way in which work was used really to construct people's own confinement within institutions. But I brought this up because this wall, because this was like a very, symbolic, metaphoric wall. And now we kind of have new types of walls. And these are really the bureaucratic walls. And so, as a disabled person with most of my community making up the disabled community, I will say that once you brush up against any of the thick walls of disability bureaucracy, whether that's finding disability supports or accessing inpatient treatment, or even accessing various forms of medical treatments or pharmaceuticals, um, you are forever haunted by the deaths of your disabled peers, friends, lovers, strangers, and co-conspirators. These walls just have that effect of producing new and old ghosts, and ghosts who very rarely get to tell their stories. I think that perhaps that's the good thing about ghosts is maybe they're a bit more loose-lipped than government records. But I think it's really important to recognize that the shift from large scale public institutions, which created its own challenges in accessing records, especially when they're all controlled by the state, um, shifting it to nonprofit residential facilities didn't actually shift the information barriers. It just changed who was responsible for them and what type of frustration we would be having as academics and journalists and nerds and friends and community members. Okay, so we got the old walls, they were bad in very significant ways, but now we have kind of these new walls. And so I have four examples of just like contemporary institutions that people might find themselves in. So on the bottom, sorry, lost it. There we go. Okay. So we have four images of types of residential facilities. A large brown, kind of shabby looking, really big house though. And then in the middle, there's you can tell it's a nursing home corridor because it has really bad art and there's some older folks in wheelchairs. Then we have a prison, and you can tell it's a prison because there's no one around, which is how they like to show prisons. And then the last is another large, shockingly big house, and this would be a rooming house. So I bring these up because the first like recommendation I'm going to give, and I'll give a few suggestions along the way, which I've gathered at the back end of the presentation. But the first challenge of FOIs for disability is figuring out how it all works. Because as FOIs have come, as Kevin has taught us all well, that there is wonderful possibilities in understanding what is behind these massive walls. But the first thing you have to do when you are engaging in disability information is you have to understand who is responsible for all of these places. And this is a lot more complicated than I think we give it credit for. And it was so complicated that I made it my master's thesis because I couldn't figure it out. So this is a large scale typology that you do not need to understand. And I'm not going to do the work of image describing for you, but I will just describe aesthetically what it looks like, which is six large folders, each with, or boxes, each with sub boxes containing like 5 or 10 different places, and then each with its own description. And so this was kind of like how I was able to do my FOIs was I went through every type of facility I was trying to understand, and I found out who funded them, who regulated them, who managed them, who owned them, who lived in them, the whole 9 yards. And this is hard. This is like really hard work because you, if they all have the same name, it's hard to figure out who's responsible for it. So there's like five different types of group homes. They are all run by different people, and only like three of them you can get FOIs on. So, like, figuring out that work is really, really important. And I think, like, this is definitely the first task. And I would encourage everyone to, like, do as much of this background work, get as much of these details as possible, because it is really what builds the backbone for how you're going to engage in these requests. Okay. So I'm gonna start getting going into like more detailed cases. And so at this point, I would really encourage people if they have questions as I go to bring them up because I would definitely love to talk about them as we are going. But Kevin, I can't see the chat, so you'll have to let me know if there's questions as they come. Cool. Okay, so we have talked about institutions that have closed, institutions that have opened, and now we're going to figure out how to get into those institutions. Um, and so let us dig in a little bit. So there, how I have engaged FOIs and access to information has been on a like three-part scale. So would be individual, and then institutional, and then systemic. And the reason for doing this is a couple. So um, I was very, very lucky to be taught how to do FOIs in a workshop that our dear Kevin Walby helped put on a couple summers ago with AJ Withers. And AJ Withers does amazing work doing case studies and direct action cases. And so my work on individual FOIs has really emerged out of learning from and with them and getting that as my background. And so through my experiences and community, I have been in contact with lots of different folks who require or are trying to figure out something that happened. So usually this will be about either their child or their friend or their sibling or a family member or XYZ. Sometimes this is also like I have heard something from, like I was contacted by someone who then passed it along to someone else who then like told me the story of of like something really messed up that happened, right? So this is typically abuse, death, or a incredibly serious event, whether a fire or a catastrophe of some sort. So during COVID would be a really good example of how this happened. And so the first lesson that I'm going to share is that if you have a child, parent, sibling, friend, peer, neighbor who has experiences encountering institutional systems, any of these guys, prisons, group homes, psychiatric systems, developmental addiction, uh, carceral, you name it, you need to work together to develop a plan for your records in the event of your passing. And this is horrific and terrible. And you really like, I fully recognize that this is a big ask for people. But it's also like bad things happen and bad things happen in residential settings. And the only way to really fully be able to understand this is through being able to access your friends' records if they pass. And so I have seen this rather systematically in terms of individual record access, where I will have known either an individual or they will have had perhaps like not a guardianship agreement, but they made all of the care decisions with their child, like collectively. And so in that case, if they didn't have a written agreement notarized by a lawyer about what would happen to their files when they passed, then you would have to go through the process of not just filing an FOI, but of getting a next of kin in order to assure that your child is what you are the next of kin for your child. And even if they don't have any assets, you will still have to go through the small asset process to be able to get the certification from the justice, like the Chief Justice or whatever of Ontario, that says that you are entitled to these files. And so I know this sounds very like fatalistic, but it is really important to think about what in the worst case scenario, what you would like to happen and how you would like these documents to be treated, because it is really horrific the way in which developmental services engages families after deaths, in that there's not a lot of information that is shared. There is very little shared about the months prior to the passing, and very little shared about the day that someone might have passed. And so the only way you're going to be able to get that personal information is if you kind of have a plan in advance of their passing. And so just to say that in accessing personal information, there's like another challenge, but I think it's actually kind of a possibility, which is that patient files are horrific. So we see on this file, there is a 2-year-old who died from septic thrombosis. And this child, they said that part of the reason for this septic thrombosis was that they had mental retardation, which we know is not at all a justification for death. And so this is like an incredibly common reality of that developmental disabilities are placed as a cause of death, and then no other information about the cause of death has been provided. And so it's very important that you're able to access these details. So while individual records can make clear how homes or schools are communicating regarding an individual, which is particularly useful in understanding how abuse, injuries, and illnesses are communicated. It's important to remember that this is substantially different from understanding what is happening in the home. So we can learn from FOIs how things are talked about, but we can never actually learn from FOIs what is happening in a group home, in a long-term care facility, in a psychiatric facility, unless we're there and unless we are experiencing the conditions as a labeled person. And this is helpful to remember because it allows us to remember both what's possible from FOIs. We're not going to get the truth because that's not necessarily what we're searching for. What we're searching for is the information that they're sharing and they are bringing forward. Okay. They're all so I was thinking about this last night because I was feeling guilty about things being so morbid. And then I remembered and I have this constant reminder in my work about why deaths are always kind of the bar of what is inexcusable. And over time, this has changed. We've seen that deaths are increasingly accepted as a function of institutionalization. But the reason that deaths are shared, or that deaths are often what I am talking about or I'm researching, is that when talking with politicians or people who are capable of making changes, they really don't care about anything else except for, okay, if you say something is bad, how bad is it? And so that is kind of what FOIs do, is tell us how bad something can be in terms of just like aggregate data. And so in the context of residential facilities, often deaths are the only things that will break into the area of what people care about. And it is really, really challenging, both like for me, I don't want people to die. I don't want to be researching deaths nonstop. And also for staff, for individuals, for families to figure out what is happening. And yeah, so just to say that deaths and violence and outbreaks and abuses are all I return back to them frequently because they help us to quantify the horrors in a way that media can care about. And we have to get media to care because often that's the only way that FOIs will be granted. So I'm going to give two examples of this like media FOI connection. So the first one is the case of the Brantwood Residential Center in and the Christopher Robins home in 1990. And so these were two large residential facilities. The Christopher Robins home was a home for children and babies. And the Brantwood Residential Center was for young adults and adults. They're separate, they're not at all connected, but they happened within the same years. And so within the Brantwood Residential Center, there was a series of 10 deaths that were not investigated and did not go to the coroner. They didn't raise any suspicions until it got to the point that it started to be leaked to the press. And so then once it was at the point that it was being leaked to the press, they started doing an inquest. And once they started doing an inquest, other groups got involved. But at this point, this is actually what changed the Coroner's Act, was this inquest, because there was several different organizations who became involved. It was actually the first time that people labeled with intellectual disabilities were able to testify in and intervene in a case. But this case really made clear that adults who lived in residential centers, unlike children who were living at the Christopher Robin home, there was an immediate response to the babies who died. There was 5 babies who died within the home in a very short time frame. There was 10 adults. And in the case of the Robins home, there's more care for babies. And so they were like, this is like a shame. We need to immediately investigate this. It wasn't for 2 years until the Brantwood Residential Center was able to be fully looked into. And at that point, it had to be done through a series of FOIs, largely done by Kevin Donovan over at the Toronto Star. And so this changed the Coroner's Act. It meant that developmental disability institutions, deaths that occurred there would have to be investigated with it under the Coroner's Act, which is really big, right? Huge change. But the FOIs that went through at that time didn't actually really follow through as the Freedom of Information Act was changing. And so in 2001, Kevin Donovan experienced the same situation where he was trying to figure out what was happening in group homes. He'd been leaked a bunch of stories. So he goes to the Freedom of Information request. The information and privacy officer, he has to bring the case forward. And it stalls out repeatedly. And it's only after it gets to the highest decision with the information and privacy officer that it's determined that he, as like a big Toronto Star reporter, was capable of publishing this information in a way that people would care about. And that's very distinct from a very similar hearing that happened just 2 decades late, 15 years later in 2016, when a family tried to look into what was happening in one specific group home. And they were said that they couldn't get that information because they didn't have the same cred that Kevin Donovan had at the Star. So I say all this stuff about journalists within the context of facility level information because facility level records are some of the most difficult to access. This is not entirely clear to me why. I mean, it is clear to me why, there are privatized organizations that are able to like hide a lot of the like really big things that happen until the whole system is reviewed, which we'll get into in a second. But also it is very strange that a, a parent and a reporter are treated very different, even though I know that there's a bunch of parents here and they never have any issues getting information out. They're pretty good communicators. um, and so there's a lot at stake in addition. With Kevin Donovan's reporting, he found that some incredibly horrific instances. In Oshawa, a drunken group home worker became so angry with a young man that he beat the man until the blood had spattered on the worker's hands and clothes. In that same article, he documents a worker pouring bleach across a doorway to prevent a person from leaving his room. And another proclaimed that residents are a waste of skin and that Hitler had the right idea. And so these are horrific cases of violence that you can only really challenge and adequately address if you're addressing the home level, the facility level issues that are happening, because there's clearly cultures of abuse that are facilitated through many levels of, developmental services. It's the specific facilities often where some of the most egregious harms happen, and that we're able to understand what is happening on a more systemic level. But it requires us to be able to zoom in to see what is happening there. Because I'm going to get to the system level, but just to say, even knowing specific cases about group homes, schools, or facilities does not mean that you'll be able to access information from that home or facility. So in one instance, I knew about a facility where 3 deaths happened in a very concentrated time frame. And I only had contacts with one of the residents' family members. And so I was only able to access the information from that one resident's family members, not from the other deaths, even though they were within the same time frame, because there wasn't that shared like family decisions. And so what I will say on this level is that is 2 things. The first is that I really do think that there's a benefit in establishing relationships and communication with other families if your child or friend or peer or like sibling is in a group home. Part of this, of course, is this information sharing, but also part of this will be if something bad does happen, that you're able to respond in a more systemic level, because you will have to find the other parents, and you won't necessarily have any insight into knowing how to get in touch with family members. But the actual big lesson from this level of information, from the facility level, is that it's important to make note of the coordinator between the homes and the licensing and the funding agency. So in Ontario, and I'm going to just say Ontario and Manitoba because those feel like we're the concentrated group of individuals here. And so in Ontario, this would be the Developmental Services Ontario connector. And in Manitoba, this would be the RLC licensor through community services and support in the Ministry of Family and the Community Living Disability Services case manager. So that would be the facility level, my facility level recommendation. And again, I'll get back to those at the end, but just to say as we're going. And then the third case I just wanted to mention here is another example of really strong media response to abuses. And so this was actually following Connor's House, which was a group home largely institutionalizing disabled Indigenous children and children in the foster home system. And so you can see the state of the house within those images. And that group home FOI report was done by a series of journalists. And they did a really strong job in going after the home as opposed to the system at large, which is an interesting approach that is really, really challenging. Okay, so the third level of information that you're able to access is systemic. And so I wanted to share one example to talk about the possibilities of systemic FOIs. So what I mean by systemic information is information that isn't tied to a specific individual. It's not tied to a specific home. It's more just general kind of about the functions of the institution and sorry, not the function of the developmental services system and the broader disability and carceral systems. Okay, so I think one of the best examples of systemic FOIs comes from Alanis McKee and Sean Hillier, and their research was in the style of investigative journalism, which I love because, just a side note, but I think that there's such an importance in academics who are doing really practical work, doing FOIs, getting numbers and reporting them as if it is a media article, because so often media stories won't pick up these cases, and seeing the ways in which this story was shared, even though news media didn't pick it up, I think was really powerful. Okay, so Sean Hillier and Alanis McKee conducted an investigation into the forced dislocation of disabled Northerners in the Northwest Territories and their forced dislocation into Southern provinces, largely in this study within Alberta and within long-term care facilities. And so what they found and what they did was they got the aggregate number of people who were being moved from small northern communities into large southern care facilities and the justification for the move. And what they found was that there was a disproportionate number of Indigenous people being moved, and that these movements were functionally isolating them from their culture and their community in a form of incredibly contemporary form of colonization. And so in my work, I have found that systemic records are often the strongest way of being able to access information. And they are great because they can be used to kind of piece together stories of institutionalization, stories of death, and stories of abuse. But I think that the most important function of these records, of these systemic records, is actually that it provides a stronger possibility and avenue for individuals to share their stories. And so what I mean by that is that we have there's so little information and understanding of disability institutionalization, both historically and contemporarily, that it's really important that, or not even important, we can't tell stories. Like, I've never been allowed to publish a story about disability institutions without like going 150 years back. Like, I don't want to do that, but that's kind of how it goes. And the reason for that is because we have some historic data, but we don't have any contemporary data. And so, I mean, lots of the work that I'm doing is trying to bridge that gap. But it also does allow for what I found is that FOIs allow for us to talk about the contemporary in a way that we otherwise aren't permitted to, because of the lack of specific details or the lack of, you know, the story in the way that they want it to be told. And so they provide a knowledge base that has thus far been missing, that allows disabled people to tell stories of abuse, to tell stories of death, to tell stories of loss, and of neglect in ways that are not discounted, questioned, or disbelieved because they have the substantive evidence beside them. And I don't want to live in a world where that's required, where it's required to say, I was abused and here's all of the other people who were also abused. But unfortunately, that is the world that we're in. And so for the time being, as we continue to try and bring disability into a more politicized identity, as we try and allow people to understand the carcerality of disability institutions, we're able to bring forward these stories, and do just that as we share this information, as we try and recount histories and presents that are often disappeared, often obfuscated. And the archives behind me are such a barrier to all of us and being able to understand both what has been robbed of us by not having disabled people in our communities, and also what they have and we have experienced in our suffering, in our resistance, and in our fight for survival. And so, oh, I left out the systemic recommendation, which is fun, but my recommendation for the systemic level is that we do need expanded access to supports in order to allow for this information to be gathered. And so particularly things like having access to funds for FOI requests. I know I've spent about $1,000 on FOIs thus far in my research. And obviously they never say that you're broke enough to get it waived, but we keep trying. We keep trying. One day I'll be broke enough. But the systemic recommendation really is just that we do need expanded both resources and supports, and also individuals doing this work, engaging with records. And I mean, I think that like there's a few different barriers to disabled people accessing archives. There's definitely like print barriers in terms of being able to access archives in a accessible format. There's also the barriers of being medicalized and having our information be put within the realm of medical and private information. And then also there is just like this, um, it isn't often thought of within disability justice movements that this is a strategy that we can use. And so I think it's really exciting. And then the conversations I've been having both with um, organizers and friends and um, mischief makers and parents is that they don't necessarily realize the possibilities that FOIs have, and that bringing them forward and saying that disability isn't a reason to not be able to access the archives or not be able to access information um, is not, I don't think that could be a fear. And that's a fear that I would love to like work through with people, because I think that there's always ways to ask questions that yield some, sometimes bad, but some answers. And so just, I will fix this before it gets sent out. But these are the recommendations I went through. So if you have a child, parent, sibling, friend, or peer who has experiences encountering institutional systems, whether psychiatric, geriatric, developmental, or addiction, develop a plan together for their records in the case of their passing. And on the facility level, please do identify all possible coordinators between homes and the licensing and or funding agency. In Ontario, be the connectors with the Developmental Service Ontario, whereas in Manitoba, this would be the provincial RLC licensor through Community Services and Support and the Ministry of Families, and Community Living Disability Services Case Management. And then lesson 3 for systemic is get lots of money in grants. It's a good one. Okay. But just to say, beyond information, beyond data, beyond all of this, there is always going to be the evidence that is important, the evidence that Miaminga's talked about before, the evidence of wholeness, of being loved, of being cherished and known, are rarely fulfilled in our pursuits for information. It is really only upon experiencing the love shared between families, patient networks, communities, that we are able to experience the wholeness, complexity, and lightness of individual personhood. And so as community members, as disabled people, we are responsible for creating spaces where we're able to share stories, where we're able to talk about the beauty and possibilities of disability and life, and also think about worlds beyond institutions, beyond walls, beyond all of these frameworks that keep us locked in and towards a future where we're all able to be free and weird and silly and strange. Um, and so on the screen, I just wanted to share 2 pieces of art. And so the bottom, this is a piece by Persimmon Blackbridge. It is a curved, carved female form. On one side, it's a wing, and on the other is kind of a wired wing without feathers and really sticky bottom parts. And I love in her description of this exhibit that it is that they are splintered and awkward as we are. And I love that. And then also at the top is the statue by Hilary Cole called If These Walls Could Talk, located in the Huronia Regional Center Cemetery. And art obviously will always have more possibilities than data. And so I think it's important to think about our worlds and our stories beyond.
Thank you so much, Megan. Can you hear me okay?
Yeah.
Okay. Yeah, thanks so much for the important work that you do and the really great presentation. Um, I think that we have 10 or so minutes remaining for questions. Uh, Hopefully that's okay with everyone. If people have questions, please pop them into the Q&A tab in the bottom kind of right-hand corner of the Zoom page, or you can pop it into the chat and it'll just pop up and then Megan can see it or I can see it and we'll take your questions. Um, I have a first question to get us going. Um, so you mentioned moving to access with a kind of mode of doing this work. Can you say a little bit about how you developed that idea? Was it inspiration from activism? Was it training in a certain kind of research in academia? How did you develop that approach?
Yeah, access with is definitely rooted in the idea of nothing about us without us, big disability and broader social movement line. But honestly, the access with really was in my own experience. Working with on what would happen to my own medical files if I passed and how I would want to deal with those. And so it was kind of a collaboration of that and then talking with a working with a friend on trying to access some of their medical files. And so um, I that was kind of the first piece was like with in creating my own processes or for how I would want to do um, my own records to be dealt with was really how I was able to start thinking with others about how they would like to do theirs. And then also, um, activist archives are by far the most beautiful and life-giving places I've been. I toured the Essendale Regional Center in, or the Essendale Institution in New Westminster. And afterwards, I got to go to the Anarchist Archives in Victoria. And I feel like it was really the only thing that held me on because I was able to see stories about people escaping institutions and like the connections with people escaping and prisoners escaping and so really seeing the possibilities from creating your own archives and what that can look like and be like.
Thank you. We have a question from Lindsay Jennings. Lindsay, good to hear from you. Uh, Here's the question. Have How have you taken care of yourself throughout all the heavy information you are receiving and going through? What are some insights you can share about how to process reading through all the hidden and horrendous information?
Great question. Thanks for that, Lindsay. Today, I ask fellow organizers and activists this every time that they chat. I chat with them. So I gather up their tips, like little spells that I carry along with me. And today's tip was that someone gave me some sage to bring with me into the archives, and it was really beautiful. They grew it in their garden, and I was very happy to be able to take it with me and just have a little bit in my pocket and know that something was like holding me down to the earth because it messes with my head for sure a lot of the time. And I think finding weird and strange ways through it and engaging social movement organizers is definitely how I've found my way out. Also, I would encourage people to, if you ever have to do a talk, do it where there's animals around. It seems it's very fun.
If you are in the audience and you do have a question, just pop it into the Q&A tab at the bottom right-hand corner and we'll try to get it. I have a couple other questions, and we have a few more minutes. So
Yeah.
I'm looking at the Q&A tab, and if something goes in there,
Oh, we got
yeah,
one.
we have one
Ah,
from Abby. Thanks, Abby. Here's a question from Abby. I'm in a YWCA building where there have been a series of preventable deaths, especially of Indigenous women. We've been trying to organize, and while we've made improvements, we're facing barriers within activist communities. Uh, would you be willing to organize with us? And do you have any other advice about resources?
Yeah, definitely connect. And I can put my email in the I'll send it. Um, but yeah, I mean, I think that especially around issues of preventable deaths, there's often a lack of like taking it up and a lack of movement on it. And I think in part there's misconceptions about what actually is a preventable death. And then there's also misconceptions about like what our responsibility is as like survivors, as people who made it, or any of those pieces. And so I think I would um, be patient with yourselves and your peers, because I know when there's preventable deaths that also it is incredibly rushed. Like it's not something to move slowly on. And so just want to say, like, I see you and I see that like the horrors and that you do need people to help you. And so that's like the way to do it. And so, yeah, I would absolutely be happy to help. And even if I know other people who are closer to where you are, I don't know where you're based, but I can absolutely connect you with them as well. Um, but I'm so sorry you're going through that and that there's been challenges in having people show up. Yeah, Mary.
Yeah, we have a question from Mary Horodisky, and good to hear from you, Mary. Here's the question. Would community archives need to follow provincial privacy legislation? For example, in Manitoba, medical records are never accessible in government or university archives under provincial legislation, even after 100 years. If a community archive somehow had a set of case files, would they have to follow the provincial legislation?
Um, in okay, like Mary, for context, Mary is a brilliant historian who has studied the Manitoba Developmental Center and is also an amazing archivist. And so I think like what I would say is no. And particularly if the community archives like were made by the community, then no, you don't at all need to, because you're making your own space free from the limits of the state. And so I think that would be like a really exciting opportunity to make some like community agreements and develop your own set of like archival standards um, to go through, because yeah, I really do think that that's the possibility and like the only real way to challenge these institutions, whether it's an actual physical disability institution or a large state institution such as our archives or privacy legislation. The way to do that is with community. And um, yeah, I'm excited to hear about how that goes.
Especially important when we have more authoritarian governments just outright destroying records, and there's important kind of guerrilla archive uh, practices where people are creating their own archives.
Yeah, and like I know I just finished an episode on the Saskatchewan Developmental Center, the Valley View Center, and in it, the first thing that we talked about was someone watching as records were getting destroyed, because that's just how it goes. When institutions are closed, there's a decision-making process that we don't know about, um, where all of these things happen. And so, yeah, guerrilla archives are absolutely like uh necessary. I feel like I've said that word too many times today, but that's okay.
Well, I think we have time for one more question. If anyone in the audience wants to pop a question in there, last chance. Otherwise, I have one last question. Thanks very much to our media team and to our ASL interpretation team for sticking with us here. Thanks again to Megan and everyone in the audience for being here. Okay, just one last question. Can you say a little bit about how your work at Disability Justice Network of Ontario informs your approach to research and how your approach to research informs your advocacy at Disability Justice Network of Ontario?
Yeah. Oh, great question. I should make sure that whatever I put down here, I put in my thesis. I would say like the Disability Justice Network of Ontario is has been like the greatest influence on my research. And I think that comes from like a few different reasons. The first being like just the approach, the carceral abolitionist approach that we take, um, which cuts through so much of prisons, group homes, nursing homes, in a way that I think in most other places you have to do a lot more like theoretical heavy lifting, and we can really just see all of these things happen at once because our community members are seeing them happen at once. And so we're able to analyze and discuss and challenge things on a um, in a cross-sectional, like not just like I think intersectional, but also like cutting across the systems, um, from psychiatric to carceral, say, in ways that are really transformative. And I say that because honestly, it just like I'm able to cut I don't have to do that lifting of explaining why there's a connection between prisons and long-term care facilities. Within our work, we just fully see it all the time. And so I think that allows me to ask questions in a much different way than like lots of other disability organizations would be able to, because it is like so specific usually, where we're either like looking at housing or accessibility or food and not all at once. And so um, but also I get to meet a lot of people experiencing a lot of in the most clear way possible, fucked up shit that we're able to fight back in very overt and targeted ways. Um, and so that anytime you're able to do direct case work, direct work with individuals, you really see how the system is functioning. And that lets you um, ask questions differently. It like lets you dig in deeper than you would ever be able to if you're just asking questions through textbooks or however. And then vice versa. Like I think that my obsessive desire to understand who owns things has been very, very helpful in our work to be able to understand the connections between, like home care agencies and the prison system and the hospital system and our nursing crisis. And like being able to do that all at once has such an important advantage because we're able to get places like labor on board. Whereas before, we wouldn't have been able to get labor on board our struggles because we were talking about deinstitutionalization, which labor historically hates. So we're able to make progress in ways that I think is really empowered by a systems level approach where we can be like, we're fighting not just for one group, but for everyone. And that allows us to actually make progress. And I know like in my own work, like I think now I can talk about abolishing long-term care or nursing homes and people don't look at me like I'm crazy because DJNO has done that really formative work. And so yeah, it really is just amazing to be involved in an organization that does such cool stuff. And obviously we're not perfect, but I it is like I'm so, so lucky, and I'm so lucky to get to work with families, to get to work with um people like survivors, and it's just yeah, it's just the best.
Thank you so much again for sharing your insights today. Some folks are saying thank you also in the webinar chat. Uh, I really appreciate the work that you do and sharing your thoughts with us today.
Thank you so much for having me. This is so fun.
Yeah. So I just want to say thanks also to the media team. Thanks to our ASL interpreter. We appreciate what you also do. And if anyone wants to connect with Megan, please do so uh, at Carleton at Disability Justice Network of Ontario. And I know Megan would be happy to get back to you and just hear what you're going through or share insights with you about how to do this kind of research too. Well, thanks everybody.